where they've been going. Cause if they're that old, they've been going somewhere. So I've seen people that were just being lazy and just, the screen's negative. Well, give them a unit of blood. Call around. I guarantee you, they've been somewhere. So don't be scared to call around. You can save somebody's life. So some patients are phenotypically matched to prevent alloimmunization. So if they're Rh negative, you're gonna give them Rh negative blood no matter what. And we gave them CE and KEL negative blood because those are the main ones that you get immunized against. So KEL is second after D, right? And C and E are also like more immunogenic than the others. So we kept hemoglobin S negative, CE and KEL negative units on the shelf all the time in case one of these patients came in, so that we didn't immunize them. And so that was our policy, that all those people automatically got those units. And we had them phenotyped at the blood center, and so we didn't have to do any extra work. And so if a sickle cell patient came in, we would just charge them for the extra antigen charges that the facility charged us. If we didn't give it to a sickle cell patient, we couldn't charge anybody for it. And so you kind of lose a little bit of money there, but we did it to protect the patient. So iron overload is a complication of repeated transfusions. So it's common in sickle cell disease and in thalassemia. What's the big word for that? Hemosiderosis. So immune hemolytic anemias. So that's any immune hemolytic anemia is when the red cells are removed from circulation sooner than 120 days. So that's what they're supposed to live. There are three groups. So autoimmune, so that's when we're talking about those cold autoimmune anemia, or if we call it a cold auto or a warm auto, that's what we're talking about. Drug-induced hemolytic anemia. What's the drug that's the main one that causes it? Methyl-dopa. That's probably going to be on the final. And alloimmune hemolytic anemia. And so that's from if you get a transfusion or HDFN and you have an antibody. So that's due to an antibody you made from something else, from exposure. Hemostatic disorders. So one or more coagulation proteins are either decreased or missing. Or the protein has a normal production, but the structure is abnormal. So symptoms include prolonged bleeding, bleeding in the joints, and subcutaneous bleeding. The common ones are von Willebrand's, hemophilia A, and hemophilia B. And they're mostly treated with factor concentrates. And that